Over the next 30 minutes, I'll be joined by leading epidemiologists who will look at where India is in the battle against coronavirus and what we should expect next. But before that, I want to dig deep into everything the government has said so far, especially dig deep into the Prime Minister's addresses, try and pick up from there all the signals that we have about what could be in the government's mind about what to expect after the lockdown ends. And then we look at the data and try and make sense of where we are at in the battle against the coronavirus and what you should expect next.
Massive impact of India Today's do-it-yourself mask campaign. As COVID-19 cases soar, support for face masks for all finally gets the government's nod. In an advisory on Saturday, the Health Ministry recommended homemade face masks for all, saying people who are suffering from medical conditions or having breathing difficulties may use a handmade reusable face cover, particularly when they step out of their house. This was a U-turn from Centre's earlier stand on masks.
As far as masks are concerned, first we are requesting to people that not everyone need to wear mask. We are saying we have clearly defined guidelines have been issued when the mask should be worn. We have also indicated that if you are feeling cough or you are not feeling well and you want to go to a hospital facility, etc., that is the time you definitely should wear a mask. What we are primarily advocating is focusing on social distancing.
When he asked you to clap, you clapped as one. And on Sunday, the Prime Minister wants you to light a candle.
Mombatti, diya.
An appeal to unite India in light against the viral darkness. But as those candles and diyas are lit, 1.3 billion people will be united by something else. What happens after April 14th? With less than 2 weeks to go, it's India's single biggest anxiety. First, let's tell you what we know. The Prime Minister conducted a video call with state chief ministers yesterday, where he asked for suggestions from across the country. Could India follow the Japanese or German model of a selective lockdown? While a narrowed lockdown focused only on India's COVID-19 hotspots is theoretically possible, this could prove very difficult. The reason being, COVID-19 cases are no longer confined to a handful of areas. Also, with India now doubling its number of cases every 2 days, the contagion is speeding up, not slowing down. The total shutdown of public transport is unlikely to be reversed all at once. While discussions are on to consider highly regulated bus and metro services in the future, this could only happen alongside easing of overall lockdown conditions, which is not on the cards just yet. While the impact of the lockdown on the economy is immense, don't expect any sudden decisions on the opening of factories or offices just yet. The risks of a hasty decision are too great for a country this big. While India has been praised by the WHO for how it has handled the crisis thus far, expect an unusual amount of due diligence before any changes can be expected even after April the 14th. Bureau Report, India Today.
So let me first set out the big picture of where we are at in the battle against the coronavirus, and then we'll go across to our guests who are joining us, and they'll tell us what you should expect could happen and how we are doing relative to other countries. So joining us on this broadcast at this time is Professor Dale Fisher. He's an infectious diseases expert at the University of Singapore. Welcome. With us also is Dr. Geetanjali Kapoor, a research fellow at the Center for Disease Dynamics, Economics and Policy. Giridhar Babu is the professor and the head of epidemiology at the Public Health Foundation of India. Okay, this is the India Today Corona India dashboard, and I want to show you where we are at in this moment in India. So let's take the All India update first. We're about 3,000 odd cases, 68 deaths, 184 recoveries. As far as the states are concerned, it's Maharashtra that's now leading the tally of states most impacted by coronavirus at 423. There have been 42 recoveries and 19 deaths. Tamil Nadu is the state that's second most impacted with 411 confirmed cases and 1 death. Then there is Delhi with 386 cases, 8 recoveries and 6 deaths. Then there is Kerala at 295 confirmed cases. Kerala is the one state that's been relatively able to bring the situation under control. Here is where the virus tracker is globally. Remember, for the longest time, and let's just zoom in further so that our viewers can see this up and close. For the longest time, it was China that was leading the tally when it comes to coronavirus cases. Now, first Italy overtook China, then Spain, Germany, the United States. Now, all these countries have gone ahead of China. India, mercifully, is around number 30 in the global list of countries most ravaged by the coronavirus, and hopefully that's where we'll stay. This is not a race we're hoping to win. This is as far as the number of cases are concerned. Now let's look at the number of deaths. As far as the number of deaths are concerned, again, China was most brutally impacted, but it's countries like Italy and Spain that have really had to pay a very heavy price over the last several days. In India, the mortality level still relatively under control, but it's been said by people in government and outside that India is particularly vulnerable given the density of population, given the relatively poor state of our public health system. So, I want to show you now the two most important data markers which give you a sense of where we are at and where we could be headed next. So, let me show you where India stands vis-a-vis other countries of the world first. This is the India Today Data Intelligence Unit trajectory tracker. It gives you a sense of whether we're being able to flatten the curve or not, and that's what everybody's been focusing on. The steeper the incline of this curve, the more the spread of infection, the faster the spread of infection. The less the incline, the more you seem to have things under control. So the country in this blue is Korea, South Korea, and there you see, relatively speaking, they've been able to flatten the curve. China as well has been able to, relatively speaking, flatten the curve. In India, we're now on a 4-day cycle, which means every 4 days the number of infections are doubling. So that's a problematic area to be in. I want to show you the state-wise trajectory tracker. Now this is very crucial. Just bear with me, allow me to get into the depth of what I'm trying to show you, and then we'll talk about it. Now there are two reference lines on this screen. The first reference line is the dotted blue line. This is the line your state would be on if the number of cases, just come closer, if the number of cases is doubling every 2 days. That's the dotted blue reference line. There's another reference line which is the dotted red reference line. This is where you will be if the number of cases would be doubling every 5 days in your state. So if you're below this, it's a good space to be, which means the number of cases are not doubling every 5 days. It's taking more than 5 days for the cases to double, which is a good space to be in. And if you're on this side, it means that the number of cases is doubling in less than every 2 days, which is very problematic because it means that the infection is spreading fast. So it's in Tamil Nadu and Andhra Pradesh where just over the past few days there's been the sharpest spikes. At this moment, the greatest vulnerability is for Tamil Nadu and Andhra Pradesh. Now, it's states like Kerala which saw a huge spike towards the 10th of March where they've now been able to, relatively speaking, and I hope it stays this way, bring the curve under control. Maharashtra also is seeing, just if you come closer, you will see a sharp jump right towards the end. This is just over the past 72 hours where the cases in Maharashtra have now started jumping, and that is problematic because Maharashtra is now really seeing, just over the past sometime, a big spurt, and there have been cases in Dharavi as well. The other state that's problematic is Delhi, where again, if you see, there's been a sharp jump. This curve is a sharp jump, and that's problematic too. So that's the broad sense. But you know, and there was a very important point that an epidemiologist made earlier. Just because your state is not on this tracker, it doesn't mean that you're safe and well, because things could change. States like Tamil Nadu, states like Kerala have a relatively better public health system. When this moves to Bihar or Uttar Pradesh, it could change. So just because you're not at this moment in an area where the curve is on a very sharp incline, it doesn't mean that that's the way it will stay. Okay, now that I've set the context, let's go across to the guests who are joining us on this broadcast and understand from them what they're making of how India is doing. Professor Dale Fisher from the University of Singapore, Dr. Geetanjali Kapoor from the Center for Disease Dynamics, Economics and Policy, Dr. Giridhar Babu from the Public Health Foundation of India, and Siddhartha Chandra, Professor at the James Madison College in Michigan University. So welcome to all our guests. I want to go across first to Dr. Siddhartha Chandra. Sitting where you are, what's your sense of how India is doing in the battle against the coronavirus so far?
So I think India is in a difficult situation because of our very large and dense population. I think that the measures that the government took to impose a lockdown, those measures were really wise measures. They were done relatively early in the game, which is very important to do because these epidemics have a way of expanding exponentially across populations. So that was a very good move. I think the state of surveillance in India, given the level of economic progress in the country, is actually quite good. But there are, of course, many problems that India faces because of the particularities of a very large population, a very diverse country in terms of the federal structure. So overall, I think India is doing what it can do. I think the government is in a very difficult situation. There are many issues economically related that it still needs to work on. But I think imposing the lockdown was absolutely the right thing to do from the epidemiologic standpoint.
Professor Dale Fisher, you've looked at how Singapore has dealt with the coronavirus. Now India, of course, a country far more complex, far more populous than Singapore. But given where you're at, how do you see India's response to the coronavirus so far?
Thanks, and thanks for having me on the program. Every country, every city in the world, every corner of India, they've really got their own outbreak. And I think India is going to see a different style of outbreak and outbreak response, as is Europe, as is other parts of Asia, China, Africa. Everybody has different capacities. Everyone has different densities. There's no doubt India has incredible challenges. But at the same time, they've got a lot of capacities. From my understanding, I think lockdown was a very good thing. There's two reasons to lockdown. One is when you feel that the outbreak is just getting out of control. So it's time to just settle things down. In Singapore, we've done a relative lockdown recently where we're calling it a circuit breaker. It's not because our hospitals are overwhelmed, it's because we just feel like we're losing touch with our ability to contain, so we impose social restrictions. But other countries, Italy, Spain, New York, they're really locking down because their capacities are overwhelmed. So clearly it's a good thing if you feel like you're losing control to lock down early.
Dr. Geetanjali Kapoor, what are you making of the manner in which this lockdown has gone so far? And relatively speaking, in India, the infection seems to be more under control than it is in a country like the United States or Spain or Italy, which is counterintuitive to what we would have expected ordinarily. Why is that the case, and do you think it will stay that way?
Thanks, Rahul, for getting me on the show. And I'm representing Center for Disease Dynamics, Economics and Policy, CDDEP. That's an independent organization with a mission to produce independent multidisciplinary research to advance the health and wellness of human populations. So answering your question, actually where are we going to head to would be, I think, primarily whether it's after the lockdown or if it's even after a few weeks. It basically would be depending on two very important factors. The first would be how well prepared are we in terms of our health system infrastructure, the number of beds, the ICU beds, the number of ventilators, isolation rooms, the PPE gear, our testing kits, all this needs to be determined. What is our current capacity, even if COVID was not there? But now with the COVID striking us, we definitely need to ramp up and be sure that we have enough facilities to accommodate mass hospitalizations if required, as we are seeing in other countries. And second factor that's going to really determine where we head to would be how well we are complying as a citizen, individually and as a nation, to basic infection control strategies such as hand hygiene and social distancing. So these two are very important factors. And coming to the first point, that's the lockdown that has been imposed in India. Of course, as my previous speakers have said, a very bold move, a very wise move. And in fact, it's giving us a golden opportunity to buy time, because this is the time where our policymakers and the healthcare stakeholders, they really need to strengthen and expand the current healthcare infrastructure so that we are confident that we're moving in the right direction.
Dr. Giridhar Babu, it's a midway of sorts. The Prime Minister's 9 minute, 9 baje, Sunday at 9 p.m. In what you've seen in India's response to the lockdown so far, how is it in contrast to your expectations from how things would be? And relatively speaking, with all the modeling that you're doing, do you think we're doing a good job of keeping the infection under control?
Yeah, Rahul, if you have to see the entire scenario starting from the lockdown, this entire outbreak of coronavirus, not just in India, all over the world, has been giving up sort of many new learnings to many countries. So India also did have its own share of learnings. So to begin with, the understanding was lockdown was not necessary when India took the decision of starting the lockdown. And after that, what we have done so far is, lockdown is basically like a wall which controls, how many infections at what rate they come into your community. And in that, we are able to do really well. And from now on, we will see the results of how lockdown has been. But equally important, and where I disagree with some of the infographics shown earlier, my worry is not those states which are reporting good number of cases. That means those states have a functioning surveillance system. Those states also have the highest testing rates compared to anywhere in the country. Those states also have least mortality rate, case fatality rates when it comes to, because they detect early, they hospitalize early, therefore the outcomes are really good. My real worry is in terms of containment, the states which are not doing well, the states which have less than 15 or 10 tests per million population, where suddenly the deaths have started being reporting lately. So Rahul, if there is one death, there are other 100 infections which have occurred nearly 17 days ago. So now if you don't track for the last 17 days, those 100, even if they've contributed to one more person, there are 200 people. So therefore, what we need to be doing right now is find more cases and then isolate them. So
that's an important point that you made. That's a very important point that Giridhar Babu made, and I refer to that when I was explaining the data sets to you, that don't just look out for where there are cases, even if there aren't cases being reported, but deaths are being reported. That's even more problematic. So Dr. Babu, as I shift our attention to the second part of this broadcast, I want you to focus now on where you think the trajectory tracker in India is going. Between this weekend and the end of this national lockdown, if things stay the way they are, from all the data that is available, where do you think we're going next, sir?
So in terms of, again, now if we have to detect more cases, we do not have any magic wand to make sure that the tests are available everywhere. We can't be stepping up infrastructure everywhere within a matter of few days. But what we can still do is something that India has been very well proficient in, is looking at symptom complex and finding out. We have done that in polio, we have done that in other disease programs. Now is the time for us to look at disease in terms of symptom complex. Who has fever? Who has cough? Do they have a case definition that fits into COVID? Let us do home isolation. Let us look at the contacts. If we are able to do this containment procedure for the next whatever number of days we have in lockdown and beyond, we will be able to interrupt the transmission. This is the golden opportunity for us that the lockdown has given. The rate of transmission has reduced. if we are able to identify the other cases through our own strength of India, which has been through syndromic approach, I think we should be able to
But I
contain
want to
it
go
well.
across to
And
Dr.
if we do
Siddhartha
that well,
Chandra, because the problem here is you can't suddenly substantially boost capacity in the middle of a pandemic. So how do we make the most of what we have, realistically speaking, to keep the tightest watch on this infection and to stop its spread as much as we can?
Okay, that's a very important question that you ask, and I'm going to answer it in two parts. The first is, this is not India's first experience with a pandemic. In fact, quite recently in 2003, when we had the SARS coronavirus epidemic, the Deputy National Security Advisor of India actually spearheaded a task force to, they created a government report, probably the first Government of India report on how to address pandemic situations. And I think you're absolutely right. So our problem is in the immediate, in the present, we probably don't have the ideal infrastructure to manage the pandemic, right? So I would highly recommend that people take a look at the report that was written. It emphasizes three things. One, that our colleagues on this panel are emphasizing, and that is the expansion, the creation of surge capacity in our public health infrastructure. This is critical. A second is, and this is extremely important, at the end of the day, what is going to save us is vaccination. An increased investment in vaccination research, the development of technologies indigenously to create vaccines more rapidly than we are currently able to, and then a seamless pipeline into the pharmaceutical industry, again, to indigenously produce vaccines. Let me answer that. Now, let me bring a second part to this, because this is extremely important. We're caught up in the present. We need to think about the future. Okay? We have a novel virus here. And with a novel virus, everybody in the population is what epidemiologists call susceptible. Okay? And many of us are being exposed to it. And of the people who are exposed, many will be infected. And then ultimately, when they are infected, most of them will recover and be immune, hopefully. And some will be, unfortunately, will die and be removed from the population. This is the basic framework of epidemiology. Okay? Now, what happens when you impose a lockdown? The good news is you flatten the curve and you don't overwhelm the health system. But what you are also doing is you're maintaining a population of susceptible people out into the future. And so the degree to which you relax these restrictions is going to determine the degree to which the pandemic has the capability to take off again. I say this because this was observed in 1918 in the United States of America, when lockdowns were imposed for the influenza pandemic of 1918, and then in some cases lifted somewhat prematurely. There was an immediate resurgence. Okay, so these are very important issues to keep in mind. The lockdown was important. We have a maintained pool of susceptibles. How do we look at the future in terms of preventing these surges from happening? And the answer ultimately is, once we bring the wave under control, is to have a very aggressive strategy of testing and diagnostics and immediately quarantining and isolating the exposed and the infected, just like my colleagues on the panel.
Now, those are very important insights from Dr. Chandra.
Problem.
No, but I want to go to Geetanjali Kapoor, and the point he makes, it's perfectly rational that once you've had a lockdown, if things go back to normal, there'll be a big spike. To prevent that, you must have very high quality ability to target whoever looks suspicious, ensure that he's isolated, quarantine them, treat them. But that's, look at Bihar. I was seeing some pictures of this person who went into a medical center and the CMO said, "Ha, tumhara checkup ho gaya, ab tum jao." But he's overwhelmed. So, what may be okay in China, in Singapore, maybe even in the United States, is quite inconceivable in the current context in India, and that's a reality we're dealing with. How do we overcome that as best as we can, Dr. Kapoor?
So we know that we do have a deficiency of our healthcare workers, professionals, para-healthcare professionals. I think this is the time that we need to mobilize our community health workers, our health and sanitation workers, who are aware of it, so they can spread the message across to the last person. My concern is that everybody, most of us do know about the COVID, but does the common man who may not even have basic hand wash facility in his area, is he aware of the behavior of this virus? So I think we do need to convey this message across, that at least follow basic prevention and And what's basically happening is that, of course, I don't think we can ramp up. We would love to, but if we can't ramp up the testing facilities in such a short notice, the current recommendations are treat every suspicious person as COVID positive, even if you've not tested, and at least the best we can do is quarantine him, isolate him, and do a contact tracing. And I think a more cost-effective way would be, which we are waiting for, is our serological tests, because that can really go and screen in the communities and see what is the level of community spread. And we should also be moving into research in that direction, because so far every day there's a new hypothesis around this virus. And the latest, as we all heard, is that yes, it could be aerosol spread, still not confirmed, but that is what's going on. And that's why they're recommending masks now, and they've changed. So I think we all need to just stay with the latest news and spread it even to the last person who may not be aware of it in the rural areas.
In this battle, there are no easy answers, but over the past half hour, we've had some very sharp insights. For the time being, Dr. Geetanjali Kapoor, Dr. Giridhar Babu, Dr. Siddhartha, Chandra, for joining us on this broadcast. Thank you very much. I want to focus on the use of big tech in the battle against coronavirus. Now, over the past few days on India Today, we've been showing you how countries across the world have effectively used artificial intelligence and apps on smartphones with geolocate, where suspects are to keep an eye on coronavirus infections and try and prevent the spread of COVID-19. Now, in trying to build on some of the ideas that have been implemented elsewhere, the Indian government worked with tech companies to develop the Aarogya Setu app. So what I want to do first in this broadcast is explain to you what the Aarogya Setu app is, then we look at what's happening internationally, then we'll go to some experts to understand how effective this app will be, what more we need to do, and the kind of privacy issues this throws up. Here's a report on the app that the government has launched, and they're very keen that you and I, all of us who are watching, download the app and start using it. Here is more about the Aarogya Setu.
In its battle against coronavirus, India is working on a war footing to contain its spread. As cases continue to rise, the government has come up with an innovative solution. Aarogya Setu, a mobile application, has been launched to trace contacts of those who tested positive. More importantly, it enables people to assess the risk of them catching the virus.
अगर कभी भी आप किसी कोरोना पॉजिटिव पेशेंट के संपर्क में आते तो इस ऐप के द्वारा आपको नोटिफिकेशन मिल सकता है। मैं आप सबको सूचित करना चाहूंगा कि अब तक 30 लाख लोगों ने इस ऐप को डाउनलोड कर लिया है।
The app will help the government in assessing the spread of the infection and take timely steps through ensuring isolation where required. The app is powered by cutting-edge Bluetooth technology, algorithms and artificial intelligence.
जब ज़्यादा से ज़्यादा लोग इस ऐप को डाउनलोड करेंगे और सबके पास ये जब इंफॉर्मेशन सबकी रिकॉर्ड होगी तो उसमें जब प्रोसेस किया जाएगा तो अगर कोई बेसिकली जब कोरोना कंफर्म पेशेंट किसी के कांटेक्ट में आएगा तो उसके बेसिस पे मॉडल इन्फॉर्म होगा।
So let's take a look at how exactly this app works.
You can mention your gender, you can mention your age, what is the age, and you can check and type if you have any symptoms like cough or fever, do you have any comorbidities, and if you have traveled internationally in the last 14 days. The last and final question would be whether you've interacted with anyone who has coronavirus or if you're a healthcare worker. If you're none of the above, you click none of the above and it will give you a risk assessment.
The app is available on Play Store and Apple App Store and supports 11 Indian languages. With Milan Sharma in Delhi, Bureau Report, India Today.
That was to give you a sense of what India is now trying to do. I want to show you a report we put together on how different countries in the world are using technology to try and track who may have COVID-19. Once they're diagnosed, how do you keep them under check? How do you ensure they don't go elsewhere? And how some of these ideas could or maybe may not be applied in the Indian context. Take a look.
Aarogya Setu, an app launched by the Ministry of Electronics and Information Technology, will tell users if they are at risk at catching coronavirus. The user's location is tracked to see if they are in the high-risk geographical zone or not. The app, however, has sparked concerns about the user's privacy.
It is for a good cause for public health and safety, and therefore it falls under the parameters of law and is justified considering the extreme circumstances we are all facing at this point. And while the government launches any apps of surveillance, they fall under the purview of the IT Act and Section 69 and 69A of the IT Act, where it can monitor traffic and data.
The app's description says the identity of the user will not be disclosed to anyone, including the government or any third-party client. But activists are not convinced.
These applications by themselves aim towards providing data-rich insights. However, they also run the risk of mass surveillance, given that these apps are coming without any underlying legal framework or privacy protections being in place.
Just last week, central authorities went into a tizzy following a leak of the list of international passengers who arrived in Delhi just ahead of the ban on commercial flights. Experts warn of similar fallout in case of any security breach in the Aarogya Setu firewall, as it is a public-private partnership initiative.
There is also the problem of privacy breaches in using these kinds of methods. For instance, a flight attendant who was put into self-quarantine is now had a sign outside her house, and she's being refused essential services like water deliveries to her house.
After the recent airline data leak scare, the concerns of privacy activists are all the more real. They demand that the government must guarantee and ensure security of private and sensitive information must be addressed for the success of Corona Kavach app. With camera person Nasir Khan, this is Anand Patel in New Delhi for India Today.
So how should India effectively deploy big technology against the coronavirus? What are the larger privacy concerns this throws up? How do we deal with that? Joining us on the broadcast, Anindya Datta, Chief Executive Officer and Chairman of Mobilewala, has been working with different governments across the world in trying to use artificial intelligence in this battle against the coronavirus. Jitin Jain is a leading cybersecurity expert. Nikhil Pawar is one of our best-known privacy rights activists in the digital space. I want to go across to Anindya Datta first. What do you make of the government's baby steps through the Aarogya Setu, trying to use technology in this battle? How do you see this play out?
Hi Rahul, glad to be on your show. So, the privacy concerns of course are real, but personally speaking, purely personally, I probably am willing to give up some privacy to trade off safety, right? But the biggest concerns I have, or I don't know if I should say concerns, the biggest questions for me is that at the end, the app is simply a shell to disseminate information. So I have the app, and the app is constantly telling me, hey, how risky is the geography I'm in, and how risky is kind of the person that I'm close to, what kind of risk that they pose as well. So as an information dissemination shell, the app is only as good as the underlying information that is fed into it, right? So until things like spread prediction, spread tracking, unless the underlying information into the app is good, then the information that the app is giving me, it's only as good as the underlying information.
The challenge there, Jitin Jain, is that you need to get a lot of the people who have, and virtually everybody in the country now has a mobile phone, at least by the numbers, or most people do. You need to get a lot of those people to download the app, keep tracking it. Only then will you know whether you're in a COVID-sensitive zone and how are you doing. So it requires mass usage to be effective.
Rahul, look, ideally if government was to deploy such an app, maybe say a couple of months back, everybody including me would oppose it, like, this is an absolute breach into our privacy. But, these are challenging times. This is a question for our survival. I don't think except technical surveillance to the best of our abilities, there is any choice we have. Israelis did the same thing. I mean, Israeli parliament Israeli opposition parties were against deploying such military-grade surveillance. It was Israeli Supreme Court which came in the support of government. In Britain, I think till a couple of weeks ago, the ICO, the International Commission of Privacy Observers, they were opposing any sort of surveillance without users' consent. A week ago, they have given consent to do any sort of technical surveillance to ensure that we are able to stop the transmission, we are able to do contact tracing in time, and we are able to contain the epidemic.
So, Nikhil Pava, ordinarily, any of what Jiten is suggesting would immediately set off red flags. But at this moment, you ask anyone who's watching this broadcast that if you have an app which tells you whether you're in a COVID-prone zone or whether you're in a safe zone, would you like to know how far or close you are to a coronavirus patient? Most people would say yes, that is the reality, not just in India, but globally. So is mass usage of apps like Aarogya Setu the right way to go?
I think it's one way to go, Rahul. The challenge that many of us are facing right now is this ethical quandary of, how do you balance the safety of millions of people versus the privacy of a few? And this is where actually constitutional provisions come in, where the fundamental right to privacy comes in, where it says that there shouldn't be any disproportionate, violation of privacy should be only necessary and proportionate. So the question is this disproportionate? Is it not necessary? At this point in time, I think contact tracing is something that needs to be looked into. It is probably necessary, but it should also have measures to ensure that privacy. What I mean, when
this moment, Anandya Datta, can we as a society decide that yes, privacy ordinarily is very important, but till the time we get on top of this virus, because it's literally a matter of life and death, therefore some of those privacy concerns, like Jiten was mentioning, have been overruled elsewhere. That should happen in India too. Is that the right way to go, Anandya Datta?
I definitely think it's the right way to go. As I can tell you, in the United States, where we are working with the U.S. government task force, large hospital systems, and in a country where privacy is considered sort of very stringently, definitely tracking, definitely spread prediction, things that would ordinarily fall under, would be considered very privacy non-compliant, are definitely allowed. But still, my point is, regardless of privacy, regardless of mass usage, unless you have an accurate sort of count of who has the virus, who does not have the virus, who's likely to have the virus, even with mass usage, the app is not going to be very useful, right? So detection, spread prediction, and spread tracking have to be sort of up to par in order for this app to provide information that is useful.
That's a very important point you make, because you can have the best technology in the world, but unless you're testing enough and you know who's vulnerable, the phone's not going to tell you anything. What more would you like to see? Anandya Datta, apart from launching this app and trying to populate it, what more would you like to see for India to use technology as effectively as possible in this battle?
Well, I'd love to see, now there is a fair amount of consensus among people like us that are working on prediction and tracking on what needs to be done. I'd love to see the notion of a contagion graph being used in India, and it's not that hard, right? So if you even know 1, 2, 3, 10 confirmed infection sort of patients, just based on their movements, you can go back and see, hey, where have these people gone in the last 14 days? Which locations have they visited? What other people have been there at the same time that the infected people have been there?
No, that's important. Can there be, Nikhil Pava, some kind of a societal understanding that yes, for the time being, this is the way we need to go, but once the threat of Corona-19 is over, then we can revert back to normal? Is that possible? Are you concerned that this opens the gate for a surveillance state to then swoop down and play Big Brother forever?
Extremely concerned about that, Rahul, because facial recognition tools are also being used by the police. We've seen historic release of private data. This app is collecting data on the device. If that gets accessed by the government, or if this app persists beyond a period of time that are emergency measures, I think we have to be very, very concerned, and there will be legal recourses taken by civil society to address those issues. in emergency times, I think we can possibly accept some of these issues. But like I said, we need more transparency and accountability from the government, even at this point in time, just to ascertain whether these measures are proportionate or not. How much data is being shared with the government, because you can't still allow tracking of every single person who has this app.
Okay, this is where I end this broadcast. We've touched upon some very critical issues. This requires deeper thinking, and we hope to do that over the next few days right here on India Today. But for the time being, to my three guests, Anandya Datta, Jitin Jain and Nikhil Pawar, for joining us on this broadcast. Thank you very much.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.